hello, everyone. Good afternoon. Welcome to another Freethought in Florida. Freethought in Florida is a production of the Atheist community of Polk County, a 501c3 nonprofit organization. I am Sarah Ray, your host, as has been usual of late. I'm one of the directors of the ACPC. Freethought in Florida is available on YouTube and Facebook video, most podcast players now as well. Search for the show in your favorite app or find subscribe links at our website. And you can become a patron at patreon.com/polkatheists, which is another great way to support the atheist community of Polk County and the ongoing production of this show. Our many thanks to everyone who is already supporting the show through either Patreon or leaving reviews and sharing out the episodes. We very much appreciate that. Our guest today is Dr. Eric Sprankle, Associate Professor of Clinical Psychology and Co-Director of the Sexuality Studies Program at Minnesota State University. He's also a licensed clinical psychologist in the state of Minnesota and a certified sex therapist affiliated with the Minnesota Sexual Health Institute and is the director of the Secular Therapy Project. So please join me in welcoming Dr. Sprankle. Welcome to the show.
Thanks for having me.
Hey, I appreciate it. Good to meet you. I've heard many things about you. No pressure.
Sure.
We did have Dr. Daryl Ray on the show, founder of Recovering from Religion and Secular Therapy Project, back in January, and so we've got maybe a bit of an intro to what that organization is all about.
Great.
But of course, that was before the coronavirus pandemic broke out and just completely disrupted everything, and the worst of all possible timelines. So maybe we start there. I know that there are so many people in my circles that are suffering right now. For some, this is a sort of trauma all of its own, and for others, the pandemic has been like just one more layer on top of the 2020 sandwich that is kind of screwed with a lot of us, So people are dealing with a lot of shit. Break that down a little bit. What is the pandemic doing to us, to our mental health?
Yeah, I mean, obviously all we're left with is just kind of anecdotal information from what therapists are reporting, what their clients are talking about. From the sexual health side, I've only seen a few studies get put out there of like how the pandemic is actually impacting individuals' well-being, particularly surrounding sexuality. But yeah, I mean, you don't have to turn to the research, I don't think, to acknowledge that this is going to have an impact on all of us. So from my observations, more as just a professor as opposed to like a therapist, my professor observations have just been kind of like this denialism about the kind of gravity and severity of living through a pandemic when it was already rough living in Trump America.
Yeah.
And now we're given this pandemic and then social unrest with the murders of George Floyd in Minneapolis here. And so what I see is just kind of like trying to get back to normal with what we're doing in our day-to-day lives, our work, raising kids, whatever type of self-care routine that we may have had at the end of 2019. We just all want that to go back to normal. And I think that's great because normalcy gives us a sense of kind of comfort with that routine and thinking that everything's going to be okay. But I think it's also okay to acknowledge that things aren't okay.
Yep.
And we need to acknowledge that and look in our lives of where we can kind of back off and like do less, be less productive. And I know we're limited to that because many of our employers expect us just to be operating at 100%, regardless of the conditions that we're working in. So I know there are limitations there, but really looking at our lives as to where can I give just enough? Good enough, like 80%. We don't have to be running on full speed here. And are there things in my life that I can just kind of let go of right now?
I can say I've experienced that in my own life for sure. I have a full-time job that the hours are not all that great, and it's hard to care and focus on that kind of stuff when it's just like so many of us are just in survival mode. Like literally we are just trying to get through today to get to tomorrow, to get to the next day. And that's, I feel that, myself, I definitely have experienced that.
Yeah, and that requires a lot of assertiveness on the individual's part of being able to recognize that you're stretched too thin, that you can't do this, you can't operate as normally as you did at the start of this year. And how can I assert myself to back off from some responsibilities? So I've noticed that I've had to do that numerous times over the past 4 or 5 months of just like, look, I'm sorry. I know I committed to this.
Yeah.
I can't do this anymore. Let's maybe circle back next winter.
Yeah.
Maybe things will be better. Probably not. I'll delay it even further then. But right now, like, I can't. And I even communicated that to Dr. Darrell Ray, because I just started as the director of the Secular Therapy Project at the beginning of this year. And then when this first started, the pandemic in March, and I was scrambling to kind of convert all my stuff to online because the university closed. And so we were doing all remote learning. So just so much was dumped on my plate. I had to communicate to him like, look, I can keep the ship afloat, but really not take it into new ports. I don't know why I'm using boating analogy.
That's
I don't really
good.
like boats, but that fits. Like I can just maintain where we're at. I can't really take on anything new. And so it's just like conversations like that, which are uncomfortable.
Yeah.
I think for a lot of people to assert themselves in that way and to kind of back off from things that you may have promised or your pre-COVID level of productivity. Now that you have to kind of take down a couple of notches, that can be difficult.
Yeah, well, you mentioned a couple of things there that I want to kind of touch back on, the idea of normalcy, and I think I think a lot of us have come to this idea that that there is the old normal is not right, that there's a new normal, and whatever that ends up being, like we want things to get better and level off and be the new normal. And so I think we're all kind of hoping and working towards that. And the other thing that you mentioned that that is one of my, I don't know, one of my pet issues, is productivity. It incenses me that we value human life in this society based on your productivity. The idea, and this ties into all the things, and I won't get too political, but right, when we think about healthcare and everybody, right, I'm in Florida for crying out loud. We can't even get our unemployment system to work. And you think about things like that, and it's, well, why am I giving you money for doing nothing? Because we should value each other as human beings, as people, and just take care of each other. I don't get it. This hard work mentality, this valuing people on productivity. I don't know. That frustrates the hell out of me.
Yeah, absolutely. Yeah, and just from my personal opinion and perspective, that has been a frustration from always, but also definitely that the pandemic has certainly highlighted as things started to reopen. It was clear that it was financial decisions, as opposed to what is actually the safest and healthiest for the public. And I see this with the university systems as well, not just where I work. This is across the country. Decisions are being made about what to do with athletics, what to do with in-person classes, all these things. It's easy to see that they're financially motivated, and it's not really in the best interest of faculty, staff, or students.
Absolutely. I got a listener comment here. It's hard even just to get out of bed almost every day, just sitting here day in, day out, not having any kind of schedule, too afraid to even go to the grocery store, to just have time away to myself. It's hard. Yeah, I mean, I think as much as the way I feel about work, I think like my wife is fortunate enough that she doesn't have to work right now. But also, we've chosen to put the kids to the online virtual school option. And so she's not even going to like get out and go take the kids to school and pick them up at the end of the day and see other moms. And so she's just got that like stuck at home. I have no one to talk to. I have no like social interaction. And I know we're all trying to like move it to Zoom, but I don't know that, it's just not the same, right?
Yeah, everybody's going to have different needs. For some, like online connections can fill that social need that they may have. For others, they'll want to do like, the social distancing backyard get-togethers where you're not
Right.
touching anything, bringing your own chair, bringing your own beverages, staying 6 feet apart, that kind of stuff.
And then there's me.
Um,
I'm loving this. I don't like to talk to nobody. Don't
right,
call
yeah.
me. Don't bother me. I am happy. I'm
Right, I'm
mad
the
that I
same
had to
way.
go back to work.
Yeah, like I've always been pretty much of a loner and a homebody, so that
Yeah.
transition for me hasn't been challenging. But I was so used to just like a normal routine of going grocery
Yeah.
shopping, or just not having to put that much effort into like wanting to take a walk around the lake, one of the lakes up here. And so now it's like if we want to do that, be like, okay, what time of day is going to be the least crowded?
Yeah.
Um, and if we do encounter people, is there enough room on the path that we can stay away? And so it doesn't even become restorative at that point. So we're just so hyper vigilant of just trying to be cautious for our own health and well-being. So
Mhm.
that writing comment, definitely I've heard from a lot of individuals, including from therapists, like the helpers are needing help themselves.
Yeah.
Their routines are disruptive, and it just feels like every day is kind of this paradox of being extremely understimulating and boring and simultaneously like overstimulating and scary.
Yeah.
I compare it to kind of like being in any kind of meeting. If you have any kind of social anxiety, like it's
God, I
extremely
hate
dull,
meetings.
but you have to kind of like be on.
Yeah.
Uh, so it's just that feeling like day in and day out. And that's where, trying to adopt some things that feel normal to you can be helpful, still in a safe and a healthy way. And that's going to look different for anybody. And it can just be a very minor thing that can make a pretty drastic change in your mood, or at least your outlook. For me, that was just once I felt comfortable just getting in my car and like driving around the neighborhood and then coming back,
Mm.
just because I was so used to like being in my car. I have a long commute to work, and when all that stopped, I hadn't drove in like a couple of weeks, and then just getting back in my car and just like driving around
Wow.
just felt normal to me, and that was a safe thing to do. And now we just have to lower our expectation as to what is going to like bring us joy, because now I think about that as I'm saying that out loud, like, oh, my big event for the day is getting in my car and driving around for 30 minutes. Like, how
Yeah.
exciting! But it is exciting. That's
Yeah.
as much excitement that we can like hope for right now.
If there's any social change to come out of this, I think that's those two things are sort of my hope. Is that um, that idea of looking at the value of people differently, and that we would start taking mental health more seriously, like
Hmm.
as a as a society. Like, it's frustrating that we barely take care of physical health care.
Hmm.
That's frustrating, but also, we know that so many of the things that we would like to see bettered in society would be greatly improved by just simply having affordable, easily accessible, quality, science-based, evidence-based mental health care.
Hmm.
So
Yeah.
I hope we get that, a little, maybe little baby steps out of this towards that goal.
Right, yeah, and even to push it further, which would be even more kind of like optimistic thinking, of really understanding why our mental health is suffering, what
Yes.
systems are in place right now that are destructive, like what you were talking about, of valuing productivity over humanity, like those kinds of systems. We can only do so much with therapy and psychiatric medication and like self-help books if the entire system is beating us over the head.
Yeah, absolutely. Let's change gears. There's you're doing some interesting work studying Satanists
Hmm.
and I assume the intent is to like help educate other therapists about Satanists and sort of what those experiences are. Get into that a little bit for us. What is that work all about?
Yeah, so that was a project that I started fall of 2019, and it's going to be a series of studies. One we've completed, one's ongoing, and we may have some future ones too. Yeah, and you said it correctly that the goal is to view Satanists as essentially a culturally competence area for therapists. That's a diversity issue. And I was originally intrigued by this idea just reading through some of the atheist literature, atheism and mental health. And there are some articles written about atheists' experiences with therapy, experiences with stigma, and how stigma can predict poor mental health outcomes. And then how counselors and therapists really need to be competent in working with atheists who are mental health clients. And so I wanted to focus on a very, very narrow area of secularists, that just being Satanists, most of which are, I think, 90% of the ones that we did sample out of like 1,200, 1,300 are also non-theists. They're atheistic Satanists, which the majority are.
Sure.
And so we predicted that they would have similar outcomes as we saw with the atheist literature, that they experience anticipatory discrimination and prejudice just because of their religious beliefs, and how that stigma and that anticipatory discrimination can predict poor mental health.
Sure.
And then to take those results and then once the world opens back up to at least academic conferences, to start training therapists in person on this really kind of niche area.
Yeah, that's really interesting. I think about so we have some folks close to home here. I mean, there is a sort of divide. Maybe I'll do a show about this one day, but there's an interesting divide in the Satanist community, right? You have your temple Satanists and you have your church Satanists, and
right.
and there are very different.
POS, yeah.
Oh boy, those are some and very firm opinions on that too. And
yeah,
I know people in both camps, and I love them, and they're great. It's just interesting how how no true Scotsman
right
they get with each other. It's pretty funny.
Definitely, and I really wanted to avoid that as a researcher. So
Yeah.
my social media notifications weren't just filled with "that's not a real Satanist." Okay, I anticipated that anyways, but to qualify for my study, you just had to self-identify as a Satanist.
Mm-hmm.
I didn't want to say, you have to adhere to Church of Satan's idea of what Satanism is versus the Satanic Temple. I didn't want to get into any of that. But yeah, the infighting within the Satanism is quite interesting to observe, to say the least.
Yeah, for sure. And I think too, I mean, the I don't know whether the findings sort of support this or not, but I'm thinking the stigma that comes along with being a non-believer, being an atheist, the labels as you put them on, and how much sort of crap they carry with them, right?
Mm-hmm.
That as you go up that, I'm a humanist, I'm an agnostic, I'm a non-theist, I'm an atheist, I'm a Satanist, right? There's kind of a ladder of escalating ideas of what people, think about when they hear those words. We were, I may mention this briefly later, but I did a secular invocation at one of the local community city commission meetings this past week. And it was met. It was the first one that they had. So, the expectations were met. And there were a lot of people that showed up to, how dare you let an atheist speak, and what can they possibly say in an invocation? They don't believe in a God, and a lot of misunderstandings. And, of course, the goal of that is just to have equal participation in government, but also to open up dialogue and educate and all of those other things that come along with it. But we definitely see that on display here in Polk County, which is geographically large, but also fairly rural and conservative. And so I don't know where I was going with that, but.
No, yeah, I mean, there's a lot of overlap between that and my Satanist research, because what I've researched even prior to all the Satanist studies, it's just stigma and stigma management among marginalized populations. And it's a little bit of a redundancy, because if you're marginalized, there's stigma, and if there's stigma, there's marginalization that occurs. And a big part of that is how to manage that stigma. right? And
Mhm.
so a lot of stigmatized characteristics or stigmatized identities, they're internal. They're not observed by others, which would be the case with atheism or any kind of non-theistic belief like that. It would have to be disclosed to somebody. And so the
Mhm.
stigma management then is when, how, and to whom do you disclose? Because if you just are completely out, there's risks to that,
Oh,
and
yes.
that's that anticipatory discrimination that we were measuring with Satanists specifically. But atheists have been studied in that same way too. Of you engage in a lot of different kind of management techniques, stigma management techniques, in order to avoid experiencing discrimination and prejudice because
Mhm.
of that stigmatized identity.
Yeah, for sure. And I think too, like a lot of times, I think maybe it helps me relate to a lot of those issues where, I mean, the Venn diagram, the overlap of the trans experience and the atheist experience, being out as both.
Hmm.
That's the culturally, socially, there's a lot of the same sort of ideas about these two groups. And, I'm certainly hear it all. That was another thing we got to hear from some public commenters at the commission meeting this week,
Mm.
was
Yeah.
about, how dare you, the trans people. And,
Wow.
but yeah, again, it is that, that discrimination and marginalization as a
Hmm.
minority group. And it's one of those things too, that I think is interesting because like when we talk about other minority groups who are going through stuff, right? When we think about like Black Lives Matter,
Hmm.
you don't get to take that off at the end of the day, right?
Right. Hmm.
You're black, and that's not going to change. You can't just stop being black, but you can, if you have to, go through the rest of your life not telling anybody that you don't believe in God.
Hmm.
I question it. I don't know. Maybe there is, maybe they're not. Like
Right.
to different degrees, of course. But that's there's something that trans people that go through their entire lives without being able to come out because of
Hmm.
that perceived stigma and discrimination that's coming at them that
Right.
they anticipate coming at them. Yeah.
Yeah. Yeah, absolutely. That's a reality. And that's the kind of different minority stressors that exist, whether it's called proximal versus distal stressors, where those distal stressors are more the ones that you're being treated this way based on how others view you, regardless of how you identify yourself.
Hmm.
And the more the proximal stressors is more that internal process of like, I have this identity. I don't wear it on my sleeve. It's not observable to others, but that creates its own different kinds of stress
Yeah.
on ourselves. Yeah, and in the intersection of those two, you can, like you were saying, with atheism and trans, we start kind of layering all these different stigmatized characteristics, identities,
Mm.
and they each have their own. There's overlap for sure, but they each have their own kind of unique experiences.
Oh yeah.
And the research is just now starting to come out, looking at the more of a compounding impact of multiple stigmas that many people carry.
Yeah. And hey, guys, this is why it's important that we fund studying things like this. Um, so we're kind of on the topic of sexuality, and this is one of the things that I like about Daryl's work, um, and the focus in the organizations that he set up here is this passion that seems to be yours as well. And that's that sort of fundamental concern for healthy human sexuality. So you've been doing a lot of work in this area since at least what the early to mid 2000s.
Yeah.
Yeah,
Yeah.
are there any interesting observations or trends that have caught your attention over the past 15 years or so?
Um, wow, it's
It's a
difficult to think about in that large of a scope, especially when there's so much just incremental change that we just get accustomed to. That was such a big fight. I would say
yes.
like marriage equality is a good example of that. I forget why I was just thinking about that like the other day of how much of a struggle and a fight that was for the gay rights movement, and then that's happened, and
Mm.
it's like, oh yeah, that's just part of life
Yeah,
now. Adults can get married to one another,
yeah,
and it's not this catastrophic slippery slope that people are marrying horses now that everybody on Fox News was screaming about for 10 to 20 years.
yeah. And there's
Um,
certainly people who are still against that, but
yeah,
you
hmm
know, how
yeah,
quickly
yeah.
we've adjusted is, I think, interesting.
Right. I think just doing and letting, the protesters protest, but they slowly become less of
Hmm.
the kind of dominant voice
Yeah.
in the discourse. You'd be like, really? You're still kind of stuck on opposing marriage equality? Like, what year is this now? And even though that just happened a few years ago, it just
Yeah.
becomes pretty normative quickly.
Yeah.
Um, and then, so I think just as a movement of any type of sexual liberation movement, we kind of forget, at least I do, I have a tendency to do this, to kind of reflect on all the successes
Yeah.
because there is so much ahead that still needs to be worked on. Even with marriage equality, I mean, there is opposition within the LGBTQ community to even push for that because that was viewed as more just kind of respectability politics that will be accepted if we start acting more like straight people.
Hmm.
And we can do that by getting marital rights. Whereas others, like, no, we've created our own kind of relational systems and dynamics and boundaries that work well for us. That should be accepted in and of itself. We don't have to conform to the dominant narrative.
Right.
So there's even like, you know, um, pushes within sexual liberation that we've made successes in, but it's like that's not enough because that's just kind of getting it to heteronormativity in our society. Let's like break that completely,
Yeah.
dismantle it.
Yeah. It's odd how we are so seemingly still, wrapped up in a lot of that prudish, puritanical bullshit that we brought in with us all
Yeah.
those many years ago. When it comes to sexuality, and that we're, contrary to what the top Pornhub search results for the state of Arkansas or whatever it is,
Right.
those are always interesting. But but it seems that we're still we hold on to that a lot, and one of the areas where that affects us in a big negative, and that's something that that I'm certainly passionate about, and that the ACPC as an organization is hoping to address here in Florida, is the sex ed in our schools. Like most in Florida, we don't teach comprehensive, age-appropriate sex education.
Hmm.
It's abstinence is the way, and we know from studies that let me take all of your punchlines. We know from all of the studies that those lead to worse outcomes, and if we actually teach kids about how this stuff works, and how to be safe when they do it, because they're gonna do it eventually, that all of those outcomes get better. The teen pregnancy rates go down. The if you want to stop abortions, teach sex ed. I'm sorry, I'm stealing all the thunder. Where do you think we are in terms of making that sort of a difference, a change in the way that people think about sex ed? It's another
It's
big question.
Yeah, it's conflicting because I see great strides with sex educators meeting individuals where they are, and that's usually like finding online outlets of sex educators on Twitter and Instagram and now TikTok, making these great, progressive, comprehensive, inclusive, medically accurate content that has great value for youth and even adults too, because I grew up with very poor sex ed.
I
So
had
most
Sue
of my
Johansson. That was
right,
we had Sue Johansson.
yeah,
Yeah, that was
yeah.
it.
Um, so like there's great strides with sex educators really pushing for this and trying to use technology to their advantage to reach youth and young adults and I mean, older adults too, where they are, where they may not be getting it in formal settings. Because I mean that's one of the problems with the United States with the response to the pandemic, because of like our federalist system that every state can do what they want,
Hmm.
that we have like 50 different responses to a pandemic, and then we're just kind of in this mess that we are now. Um, and similarly with sex ed, it's state driven. We have a federal Department of Education, but
Do
they're not
we?
really in. Yeah,
Yeah.
with yeah, Betsy at the helm, not much. But with each state left up to their own devices, that's where I'm not seeing great strides in
Hmm.
actually implementing comprehensive, inclusive, medically accurate sex ed into the curriculum, especially K through 12.
Yeah.
And I like throwing out that K through 12 because that's the rallying cry right now, that sex ed doesn't have to begin once puberty starts.
Right.
And that's certainly a buzzword for reactionaries and other conservatives at K through 12, because they think what adults know about sex and what's important for adults, they
Right.
think that's being taught to a 6-year-old in kindergarten. It's like, okay, so we now know where your critical thinking is.
Yep.
So let's try to talk to you like a 6-year-old, because you can't seem to grasp that you can talk to someone in kindergarten and first grade about what's
Yeah.
important for them and what is actually relevant to them. And that's going to be different than what we talk to them about in 5th grade and then 8th grade and then high school and so on. So yeah, I mean, sexuality education, it's a lifelong process. We're sexual beings our entire lives, and that has nothing to do with our behavior. And there's so much about ourselves that's part of human sexuality that we need to know about. So unfortunately, I don't see great strides on the kind of the public policy end, but I think there are a lot of great sex educators out there that are kind of trying to fill in the gaps as best as possible.
Yeah, you mentioned, the younger ages, and this was one of the things that we did with our kids that the grandparents had a hard time with, right? And I think I've told this story before, but when grandma and grandpa leave at the end of the night, you get to decide whether you're going to give hugs and kisses or hugs and no kisses or nothing. Like, that's your choice. You don't have to hug anybody. I don't care who they are. And that was hard for both of our parents to like really get, and they felt hurt, they took that personally.
Sure.
And so, no, but you got to understand, like, this is the consent case that's being taught in this is something that will feed through all of the other things that we hope to teach them about their body, whether sexually or not. Through the rest of rearing them. And so, like, I'm sorry you feel kind of hurt by it, but you got to get on board with it, because this is how we should be doing it.
Exactly. Yeah. And those are some of those early conversations that are relevant to young children, would be about their bodily boundaries and starting to instill a sense of bodily autonomy in them as early as they can start comprehending like what that means, and developing the assertiveness to be able to say like, no, I'm not in the mood for like a hug right now. And then to have support from their primary caregivers to say, yeah, you don't have to give a hug right now. And like, grandma, you need to kind of back off a little bit and respect that boundary that they just established. So yeah, that's what early childhood sex education looks like.
Oh, it's so scary.
I know.
It's
Apparently,
terrifying.
that is terrifying. Because very ironically, those who are proponents of K through 12 sex education will get accused of like being sex offenders or predators, because you're talking to kids about sex and you're like actually grooming them and so on and so forth. The irony behind that is K through 12 sex education actually aims to reduce the incidence and prevalence of sexual assault and sexual violence by instilling those early values of consent and bodily autonomy.
Yeah, absolutely. I think another thing that's in our way on this one is what we're seeing now with the pandemic, and that's just this resurgence of a distrust in science. It's another sort of dark ages in a way where, look, even if by some God's miracle they would come out with a vaccine tomorrow, there's a good 40% of this country that won't get it because all the crazy conspiracy theories.
Right. Yeah.
Right.
Yeah. 5G implants.
Yeah. Yeah. Right. Bill Gates is going to put a tracker chip inside of you, and
Right.
So I don't know. Is this? So I have this thing I call Sarah's pendulum theory of everything. And it's that everything operates on a pendulum. So we're in the backswing, right? And there's another enlightenment period coming. I just hope I'm still around when it gets here.
Right. Yeah, I always joke like the only redemption that 2020 could have would be a positive outcome in November, at least in the United States. but yeah, I'm hoping that there is like enough of a swing that'd be like, okay, this is
Yeah.
bottom of the barrel for United States and United States culture right now. Like we have to like swing back to something that's better
Yeah.
than this.
All right. Well, let's we'll wrap up on the Secular Therapy Project. Now,
Sure.
this is a really awesome program that I mean I refer people to this all the time, and I'll tell you before I say tell folks about the STP and what you all do there. I will preface it with the story that I told that I tell everybody, and that is that when I was preparing to go into my gender transition, I sought out a therapist. And it was someone who does like that's what they do, right? Their whole business model is dealing with trans patients, and so I went. We settled through the yep, you're trans. When do you want to start your whatever transition looks like to you? Conversation that happened real quick, and then my wife and I came back together to sort of discuss, well, how does that work with us together and all of that sort of thing. And this woman, I kid you not, said we were talking about how we were kind of frustrated about like the job situation at the moment, and that's just life stuff. And I kid you not, Eric. She says there's this really great documentary I want you to watch. It's called The Secret.
No.
So we that was the end of that. And I tell that story anytime I call a new provider and say, "Hey, I'm interested in coming to see you," just to make sure that you're using evidence-based methodology here. Let me tell you this story, and then I gauge their reaction.
Right.
So talk about the Secular Therapy Project.
Yeah, in the simplest terms, you can think of the Secular Therapy Project as a therapist directory that clients who are seeking some type of mental health counseling or therapy who would be interested in having a secular therapist so they don't have to worry about being proselytized to. Part of the treatment plan is for you to go to church more, things like that I think is ridiculous and I've even thought of prior to becoming more involved with STP that, oh no, a lot of people have actually had therapists do that. Very unethical behavior.
You need to get right with God.
Right.
Yeah.
And so the point of STP is to ensure clients seeking secular therapy have found and can be connected with secular therapists. So for therapists to be listed on our directory, they have to meet 3 criteria. One, they have to be licensed as whatever mental health practitioner status they have in whatever state they're living in. They have to be secular. And then they have to use evidence-based interventions. And we screen. So they apply, and there's no guarantee that they'll be accepted. We have an evaluation team that combs through looking for those 3 criteria, and they're actually very strict, especially for that evidence-based one. If they're using things that are even pretty common in the mental health world, but they're not really backed by the science, then they'll get a rejection, and they won't be allowed to be on our directory. So we can promise those 3 things of the therapists that are listed. And so then clients just register as a client, and they'll be able to search therapists that are within their area just based on their zip code. And hopefully there are therapists somewhat close by, but with telehealth, you can pretty much do therapy within. Most states still require that you're a state resident seeing a therapist in your state. It's a kind of outdated system, if you ask me, but the state lines things still apply. And so, and so that's really the main criteria. We don't like specialize. Our therapists don't necessarily specialize in any one particular area. So if you're looking for treatment for generalized anxiety disorder or substance use issues or religious trauma, you would need to see if that therapist in your area does specialize in that. But what we can offer and to ensure that they are secular and they're not going to try to pray any gay away.
Yes. So a couple of thoughts. I joined a while ago and started looking for therapists, and there was nothing near me, and there still isn't, although I have told a couple of people to apply. I don't know if they did or not. That's between them and them and God, I guess. But I think you just touched on it. One of the positive things that I think has come out of this whole COVID stuff is that we've moved everything online. I saw a new my general practitioner was decent, but I wasn't like super pleased with the care that I was receiving. And a lot of that was just like the office staff was rude and stuff like that, right? Nothing really to do with my medical care, but anyway. And so prior to that, I had been driving to Orlando, which is like an hour drive from here, to see a doctor because there's nobody else around here that specializes in trans health except this one that I had now been going to, and I switched to someone who will see me virtually most of my appointments, and like maybe once a year I need to come in person. And I will it's like these people that are buying their groceries and having them delivered. I don't want to ever have to do it the old way again. That's my new normal. If I can just get on Skype with you and do our sessions that way, like that, what a game changer that is, that to get people access that may not have someone around them. I think that's great, and it breaks down a lot of barriers, and it's good.
Yeah, absolutely. Telehealth. I mean, that's one of those things that we were talking about earlier of like, what can we hope for better change post-pandemic? And that would definitely be one thing of like recognizing how much can be done remotely, not only for my role in education, but also within healthcare delivery and mental health care delivery of offering telehealth services is going to be alleviating a lot of barriers for a lot of clients who live in remote or rural areas where they would not have access, especially to specialists otherwise, without driving. I know when I was in clinical practice like 10 years ago, I would have patients coming from 4 hours away, like a 4-hour drive from the northern parts of Minnesota, because we were the only specialists down here in Minneapolis. And so now with telehealth, it makes it just so much easier to find care. And so, so if someone is on our directory and there's nobody within like driving range, check to see if therapists in your state, anybody listed on the directory in your state, is offering telehealth, because that certainly is an option.
Yeah. So so people can go to the Secular Therapy Project website and sign up if they're looking for a provider in their area.
Seculartherapy.org would be where you go for that.
Excellent. And then how do we get more providers into the funnel? Is that like do we, as the secular people who are out there and those of us who are already seeing a therapist that we love, right, do we need to be referring them and say, hey, this is a thing you should, they're going to go through the process, but there are people out there that are looking for this sort of specialized a thing, and I think you should look into it. Is that the best way we can help?
Yeah, I think just word of mouth is best. I mean, both Recovering from Religion and the Secular Therapy Project are on social media, and increasing visibility from those accounts can help attract therapists who may have never heard of us before, or confused about like what we actually provide as a platform. So yeah, just getting the word out there as best as possible would definitely benefit STP growing. We have over 400 therapists signed up right now, but that doesn't cover like all areas. And so there is still a lot of area and need for growth in states that we don't have any coverage, like the Dakotas, both north and south. I don't believe we have any therapists in our directory right now. So we're always looking for new ways to kind of spread the word, get therapists in all areas to sign up if they meet our criteria.
That's awesome. So we'll send everybody to seculartherapy.org. Do you want people to find and follow you? You run a pretty great Twitter account, I will say.
Thank you.
Where can people find you and connect?
Yeah, I'm at Dr. Sprankle both on Twitter and Instagram. Instagram's largely just screenshots of my tweets and an occasional cat photo. But yeah, at Dr. Sprankle for both of those accounts. That's where I'm most active. I have my own website too, drsprankle.com, but I kind of forget about that. That's a good thing. So social media is where I largely exist.
Awesome. Well, I appreciate you for the work that you're doing and for taking some time to chat with me today. And we'll get together and maybe do it again sometime.
Sounds great. Thanks for inviting me.
Awesome. Thank you. Have a great one.
You too.
All right. What a fantastic chat there, and seriously, great organizations and the work that they're doing with Recovering from Religion and the Secular Therapy Project are just top-notch, much-needed services in the secular world. So before we go, I did want to mention again briefly, tell you the story about the secular invocation that I gave this week in Lake Wales. There is a lot of media sort of swirl about this. There's some news stories that you can read on our website. But essentially, I was asked by a community member, someone who's been engaged with the atheist community and a resident of Lake Wales, if I would be interested in giving a secular invocation, sort of like I did for the Polk County Board of County Commissioners. And I said, sure, I'll ask if they'll have me. I'd be happy to do it. And they did. There was no pushback at the time. And we're sort of, I think, figuring out the pieces from it now about, that the city attorney knows what the case law is on this. And, they even mentioned at the meeting that denying me the opportunity to present an invocation could have opened them up to a lawsuit. Not that I'm looking for lawsuits. That's not a thing that we're really about. Again, like I said earlier, what we're really trying to do is represent the non-theists in the community, engaging equally in government. And if some positive education can come out of that, then fantastic. That's wonderful. I think as an organization, most people know our sort of our preference would be to not have invocations at all. Get rid of them or go to a moment of silence is sort of the preferred from our position. Largely because like the idea of praying before work, or having a pastor come pray over you before work is a little silly. We don't, you don't go to work your shift at Walmart and have the local pastor come in and say a prayer before your pre-shift meeting. So it's silly that we still hold these traditions in our government. But if barring those things, then the courts have said you can have them, and that if you have them, they have to be non-discriminatory and open to all. So that's really like where we're coming from here. It was mixed results as expected. There's a really great article, and I'll link this on our website too. That was written in response by Dr. Moyer, who is normally the pastor who provides the invocation, and his response was positive, and so I very much appreciate his words and thoughts and support in support of us and me in that circumstance. So there is another secular invocation being performed by a member of our organization coming up next month. In Davenport, Florida. We'll give you more information about that when we get it scheduled. I also want to mention that we are hosting a voter registration drive. If you want to help get the word out, again, we don't endorse any parties or candidates, but we do encourage everyone to be engaged in the process. And so now through August 19th is when we're really starting to drive and push forward. August 19th is the official event date for the voter registration drive. It is the day after the primary elections here. And so that will hopefully give us a little momentum. It's too late to register for the primaries now, but if you register right after the primary, if some whatever the results happen and help motivate you to become more involved and engage in the election system. We want to make that as easy as possible, and so you can find all of that on our social media as well. And along with that, this is part of our voter education series, I guess. So along with the registration drive, we have polled all of the candidates who are running for school board, county commission, state legislature, and U.S. Congress on questions relating to government, education, and social issues that are of interest to the atheist community, if there is such a thing, the atheist community at large. So there are questions about invocations. There are questions about comprehensive sex education. There are, questions about school voucher programs that fund private, sometimes religious schools. So for those who have answered, you can see all of those answers on our website as well. And again, we don't endorse any candidates. Just we took their information and posted it up on the website, and so you can go there and learn a little bit more about the candidates that are running in any of the candidates who are running for a seat in office that represents any part of Polk. Were included in that voter's guide, I guess we can call it. So that's it for this episode. We'll be back and do some more things coming up soon, where we'll probably talk more about the invocation, and maybe I'll have Joseph Richardson come back on. He was there, and I very much appreciate him coming all the way down here to support us in that. So maybe we'll do that next. Anyway, you can always find out all about the ACPC. You can make a donation. Go to polkatheists.org and at polkatheists on all of the social media accounts. And remember the 3 most important things. Don't touch anything, wash your hands, and wear a mask. Be safe, and we'll see you on the next Freethought in Florida.